Mr. Chairman, thank you very much. I also wanted to salute Ms. Presley for having the idea for this excellent and important panel discussion. Let's see, Ms. Bethel, I want to start with you. Are you at Johns Hopkins?
I am.
You are good. Okay, so you were a Marylander, so I want to start with you. The question before us today is important, obviously, for humanitarian reasons, and this is a week where a lot of us are focused on the condition of children in our care and custody. But it's also important in terms of the future. I saw a documentary about abuse of kids at a Catholic girls' school in Baltimore, which is just utterly horrifying and shocking. But how do you break the how do you break the cycle of trauma? Because the people who are the victims of it can themselves become the perpetrators, right? Later. So what do we know about that?
I mean, I'd like Dr. Shervington also to contribute, but what we know is that when people experience trauma and become perpetrators, they're deep in their own self-shame and their lack of self-worth and the inability to imagine it could be different and have a lot of hopelessness. And so one of the first things we need to do is recognize that until people have something to live for and they can have their shame deactivated so they can understand that something happened to them, because that's what the pattern is, that we're not going to be able to really engage them in the kinds of healing processes that they have to go through to not be facing an amygdala that basically hijacks them with anger and leads them to lash out, that they often regret later, but it does damage because these are very basic biologic, mental, and neural capacities to be able to handle stress. And when you've had that happen to you as a child and you become a parent, it can be almost impossible to control yourself if they're on the perpetrating side. So, we really need to protect children, and we also need to help the perpetrators in very clear ways who are often really suffering themselves.
Thank you. Mr. Patterson, the Cincinnati Enquirer says that 1.2 million Ohio residents have gotten health care coverage through the Medicaid expansion. Of those, about 630,000 receive treatment for mental health or drug abuse problems, and 290,000 people left Medicaid after getting a job or increasing their income. What would the impact be of rolling back the expansion of Medicaid coverage in Ohio today for children who've experienced trauma?
Well, it would be a devastating impact because those perpetrators who are able to now seek treatment through mental health services, for their mental illness or their substance abuse illness, would no longer have that capacity. And I would tell you that in our community, if you don't have Medicaid or you don't have another insurance, you're not getting treatment. There is no free treatment. And so the cycle will continue or will actually get worse if we pull back what happened. I'm sure in our state, our legislature didn't act on that either.
Right. Well, I appreciate that answer. Mr. Henry, the program that you led in Tennessee is called Building Strong Brains Tennessee, emphasizing that brain function and neurological resiliency can be strengthened through specific interventions, a theory that was informed by several scientific symposia and studies and findings. Can you discuss the importance of drawing on scientific data to create public policies that address the impact of childhood trauma?
I think that that it's incumbent upon all of us to draw from everywhere we can, and the impact of us not getting the expansion dollars. I mean, it's kind of amazing where we would be right now if we did. And
did you try to use science in the process of convincing people in Tennessee of the
we
importance
couldn't get it on the agenda. Neither speaker would bring it to the floor.
Maybe you're the right person to comment on this, or anyone else who has expertise on it, but I was fascinated by the finding that kids who experience trauma are more than doubly more likely to be bullied by other kids, which was a shocking thing to read. You would think it would be the opposite, that the kids would be more sympathetic and tender. But what is the basis for that finding, and what can be done about that problem?
And before you go ahead, Mr. Raskin, I'm advised that votes are about to be called, so I want to get as much testimony and questions as possible in, so if you could be concise in your response, and we'll go to Mr. Ruda.
I'll just say that actually someone earlier said that, there's different ways that people act out in trauma. They act out, and it's more assertive and aggressive, and we can see those behaviors, but there's also an acting in. And children who have ACEs can often appear to be very vulnerable and to be victims of people who are more perpetrating, but they both share probably a lot of ACEs. Most of the children who bully have ACEs, and most of the children who are bullied have ACEs.
Thank you.
Both.
Important point.